The function of a healthcare system is to provide access to care to the citizens of a country at a reasonable cost and at a reasonable quality. The healthcare system in the United States fails on all three counts. The proposals in Congress now will not succeed because they can only succeed on two of those fronts. The only approach that would work, that would deal with all three fronts, is a single-payer system. It can provide access to care for all the citizens of the United States at a reasonable cost and provide a mechanism in which to evaluate the quality of care in that system. That's why I support national health insurance through a single-payer system.
Good afternoon, everybody. I don't know if you know it by now, but there is a actual set of health care bills being considered in Congress right now. One thing that unfortunately is not being mentioned often is the actual decision that has to be made, and that is, are we a community of human beings who take care of one another, or are we a loose collection of freebooting pirates grabbing for all the profit we can? Frankly, in the healthcare situation, it should be a right, not a privilege afforded to those who can afford it. Single payer right now is the only thing in Congress that would actually accomplish this. But again, are we a community who takes care of each other or not?
Good evening. I'm a practicing physician and I'm now in my 42nd year of medical practice. So I've been able to look the scene over for a long time, and I've never seen a situation as dysfunctional as it is now. In our office we service 70 plans with 4 physicians, but those 70 plans subdivide into 334 different benefit packages throughout this community. We have to hire a computerized billing service in order to process that, because we want to practice medicine and not practice business. So you can see a multi-payer system like this costs a great deal more to process than a single-payer system where the funds would be going directly to the payee and the payer. So a multi-payer system is economically unsustainable, and we should really move ahead and do the right thing and get single-payer funding for our citizens. It should be a fundamental right.
My name is Gay Evans. I'm a retired nurse practitioner from El Rio Health Center. At El Rio, we took care of people who did not have insurance through the regular channels, usually. I became convinced of the need for single payer when I had to work very hard to try to get people get tests and get them paid for. The other thing that convinced me of the need for a single payer was the numerous forms, different forms that we had for each insurance company. And we were always having to redo them and to redo the paperwork because it was the wrong piece of paper for the particular test or the particular insurer. I cannot see any way to lower the cost of health care unless we have single payer. The insurance overhead is 30%. Medicare overhead is 3%. Medicare for all is the solution. Thank you.
I'm not a particularly pious man, and I don't go to worship very often, but there are things that I understand from my religion and others that are pretty common. There are certain admonitions like feed the hungry, clothe the naked, and heal the sick. And these should be the starting points of where we make our social policy on some of these very important issues like health care. If your health care system does not heal the sick, if your health care system leaves people out because there are incentives to exclude people who may have a bad history, a bad medical history, may be vulnerable, then what's happening is we're causing the weak to become weaker. We're not helping, and we're not doing what, in my feeling is the strongest and best of the teachings that we have.
Here's a short vignette about being a physician and dealing with our current healthcare system. I'm a cardiologist. I had a patient who had heart surgery several years before, complicated with multiple bypasses, and he came to see me and needed another heart operation, in this case to close a small hole in his heart. The solution, the best solution, was to have him done robotically, which means he had to go to a center in another town done by a specialist who is trained in robotic surgery, as opposed to having a formal heart operation. I appealed to his insurance company and got nowhere. I wrote several letters and got nowhere. Several months passed. I probably wrote 3, 4, possibly 5 letters, and finally was able to talk to a national leader in the insurance company, who finally agreed to allow the gentleman to have a surgery, which took approximately 4 months from the time we started till the time we finished. With a single payer system, his surgery would have been done and he would have had the best of choices within several weeks of making the diagnosis. Thank you.
For a number of years, I taught young kids in a school, a very low socioeconomic area, and I can't tell you how many times I would have students come to me, sometimes on a Monday morning when they'd been injured on a Friday evening, and say, "My mom said I have to go see Nurse Pat." Our poor, overworked school nurse was giving primary care to all these children because they didn't have health insurance. I was born in Canada, but I left there when I was only 5, so that was long before the health care, before their national health care. But all the years, as long as my parents lived, their dear friends would come and visit, and they were in touch with them. They never had a complaint about the health care. They had excellent health care, and many of them had serious issues. I can't comprehend why anybody is opposed to a single-payer health care plan, except, of course, the insurance industry. Or perhaps the politicians who want the gifts from the lobbyists. I can't comprehend it.
The only way we're going to resolve the tremendous difficulties we have with health care in this country is to have single payer and to get the private insurance companies out of it. When there's a system where it's in somebody's interest, like the insurance companies, to deny care to those people who have insurance, then we're never going to get out of the problems that we're in. Not only the people who are uninsured and underinsured, but the people who have insurance and who are simply denied care by insurance companies. It's a total disgrace.
I'm outraged that my health care and that of my family and fellow citizens in this country is driven by profit-making and Wall Street, and not by the health needs of those who need health care. I'm outraged, but I'm feeling a bit hopeful and optimistic now, because maybe, just maybe, we can correct this with a single-payer health care plan.